Hello everyone and welcome back to another episode of Health Yes, here at Cameron County Public Health, where we talk about all things public health and more. I am your host, Javier.
And I am Andrea Gomez.
And today we are joined by Miss Norma Guevara from Dentists Who Care.
Oh, yeah. And I think, Javi, this is going to be a very interesting episode. And I know I tend to say that in our intros to our podcast, but it was referred to us by our health administrator, and she was very impressed by Ms. Norma. Yes. I am so excited to meet her. I am excited to know what she's all about, and I'm curious to know as to what aspect she brings for oral health, because I feel like we don't talk about it enough.
What exactly is it that we're going to learn today about Dentists Who Care? We're going to find out today in today's episode. Welcome.
So, Ms. Norma, so glad that you could join us today. Before we dive into what it is that we're here to talk about today, could you tell us a little bit about yourself?
Yes, I'm Norma Guevara. I am new to Dentists Who Care. I just started in January of this year. Never worked in the nonprofit sector, but I've been on the opposite side of the nonprofit sector as a board member for several nonprofit organizations in Hidalgo County. I'm vice president of the Food Bank Board. And and just other organizations as well. I've always been one to always try to help people. And so when the opportunity arose, it sounded like a good challenge for me. And I've never been in the dental field, but I have two sons that are dental hygienists.
Wow.
Yes.
Kind of meant to be.
and they tell me, Mom, it's kind of funny how you ended up in our field as well,
Right,
you know?
right.
So I've been in hospitality. I mean, and if you think about it, hospitality is something everybody does on a daily basis, right?
Yes.
So, it feels good. I mean, I really love what the organization is about. Mm-hmm. And I'm very transparent about everything, and I want everything to be done right. And I want, just everybody to know who we are now. Mm-hmm. Because, like I said, I'm very active in the community, and, friends of mine are like, well, we used to hear a lot about them, but we kind of thought it didn't exist anymore because we hadn't heard about the organization anymore.
Got it. Mm-hmm.
And so, a lot of branding, a lot of community awareness, and so, which is what happened when I came to talk to Esmer.
So talk to me about that.
So I reached out because we'd done 2 health fairs. And so, but to get there, I mean, we didn't have any brochures. We didn't have any marketing material, nothing. So in December, we'd go paint during the day, and the evenings, I'm like, okay, I got to do something that I've got to be able to have something tangible to take to people. So I developed a brochure.
Okay.
And so, it's all about presentation to me. So I said, how can I start going out and seeing people if I have no marketing material, nothing to show them? So in January, that's what I did a lot of, finalizing that. And I really didn't start coming out till February.
Okay.
But I reached out to Esmer. I found her on the website.
Okay.
And I reached out. I sent her an email, and introducing myself. She thought originally, she still didn't know who we were or what we were all about. So when I came to the meeting, everybody that was with her, because she had her team, thought that I was approaching about being included in a health fair.
Oh, okay.
And I'm like, well, yes, but let me tell you.
I have a little side quest.
Yes.
Yeah.
I mean, I'd like to be able to partner with you all so that you could refer patients to us. And she's like, Javier, explain that to me.
Right.
And I said, well, we're Dentists Who Care, and we we provide dental services for patients who can't afford it, who are underinsured, uninsured, and don't have the financial means. I said, we don't provide the dental services because we provide no services at all. We're like the middle person. So we align the patient with a volunteer dentist. So we have a network of dentists who volunteer their services to us for these patients that need the dental care. Okay. And so we'll find, the patient will fill out the application, they'll send it in to us, or whatever organization, like for example, you all, the Cameron County Health Department will send us the application, and we'll find a doctor, a dentist that's close by to their home address, so that we're not going to ask them to go to McAllen if they live here.
Right.
And likewise, we're not going to ask somebody from McAllen to come to San Benito.
Right.
Of course.
So we have doctors in Brownsville. We have one of our board members and doctors is in Los Fresnos, and we have another one in Port Isabel. So we have them all over in Rio Grande City. So McAllen, Edinburgh, Far, all over the valley, because we service valley-wide.
Gotcha.
Got it. So essentially, you function as a resource hub,
Yes.
of sorts.
Yes.
Where you just connect to where needed.
Yes, in dental
dental.
only.
Right.
Yes.
Wow,
So
that's
yes.
so
Very nice.
interesting.
And originally, like I was saying earlier, 30 years ago, a group of dentists are who founded the organization because they saw such a strong need in children. So originally, we only serviced children. And we had a
Okay.
mobile unit. We had a mobile unit that used to go to all the different schools, out to the colonias, to the very rural areas. But in order to make this mobile unit function, you needed a dentist, you needed an assistant, a hygienist, a whole team had to go out there. And in today's day and age, to ask a dentist or any practicing, doctor to leave their
Practice.
office, their practice for an entire day, they're losing revenue.
course.
Of course.
Yeah.
And to ask them to go out with the whole team, it's a lot. So I honestly like that now. We set up the appointment in the doctor's office and they schedule them along with all their other patients, and it just gives the patient the whole dental experience of going to the office. They don't feel singled out.
Right.
They're just like everybody
They're like
else.
any other
Yeah.
patient.
Yes.
So, question: are these services low cost? Are they free? How does it work?
So they're free to the patient.
Okay.
We do reimburse the doctor a nominal fee. The X-ray and just the checkup that's their donation.
Okay.
But in addition to that, like for example, if the patient's total bill is $900, we will reimburse the dentist $300, and then the rest, that's their in kind.
Okay.
Oh,
Yes.
okay.
Yes. So there is no charge to the patient. Now, once they're there, and if the dentist sees that they have all this other work that they need, they'll discuss that with the patient. If the patient has some means to make payments and get the rest of the work done, then they can. If they absolutely can't, then the dentist will call us and then we'll work something out to where if the patient has to go back multiple times, they'll do the in-kind and we'll continue paying the $300 for each additional visit.
Wow.
Depending on the
It's
patient's
case by case.
Yes.
Right.
It's all case by case.
Wow.
Gotcha.
So, and like even patients who have insurance, dental insurance only covers usually 40%. Most dental insurances. And then you have the deductible. So that in itself is a whole huge expense already, depending on what the patient needs. So, it used to be where if you had insurance, well, we really save what we have for people that are uninsured. But there's people that are insured
And
that
still can't
and
afford.
still can't.
Right.
It doesn't mean that they have a lot of money.
Right. Right.
Especially your elderly. And so we're taking that on a case-by-case basis as well.
Wow.
Yes.
That's so cool. That's good to know. And,
Yes.
I mean, honestly, I'm going to be 100% honest. I had never heard about dentists who care
Right.
until a couple of weeks ago that Ms. Guevara, our health administrator, mentioned that they had met you and that you brought all this energy and that you'd be great for the podcast
Right.
and, not needing the exposure, but
Welcoming
taking
it.
advantage. Of
Yeah, of
course,
course.
like that
Yeah.
exposure is always welcome, and that's exactly why we're here to talk about it because I feel like these are the types of nonprofits that people need to know more about.
Yes, absolutely. When we did a health fair at Knapp Community Care a couple of weeks back, and I'm all about meeting people and
Of
making
course.
contacts and stuff. So I talked to all the ladies that were there from the different clinics.
Right.
Acción, Nuestra Clínica del Valle, and there was another one, and they were like, there is no one with your services. No one's out there providing oral health services.
No.
She's
And
like,
that is
where have you
right.
been all our life, you know?
Hey, I just got hired in January. That's where I've been. Yes.
So, I mean, reached out to all of them, had a meeting with the Hidalgo County Health Department as well, with the Hidalgo County Head Start program. They were like, you mean you will see our children? And I'm like, absolutely, because you've got children that fall through the cracks because they don't get any services at all, you know? And I don't know if that's some of the things that we can talk about, but you know what I'm talking about.
Yeah.
Right.
So, and especially with all the stuff going on and all the uncertainties today,
Yes.
but people still need health care.
Exactly.
You know, dental care.
And I
So-
mean, also, we know that this happens, that people that might not have insurance for XYZ reason might get a treatment at maybe not the right place with not the right people. But because they need the service, they'll go through that or
either it's
put
an
themselves
emergency
through
or
that
they just-
thinking that there's no other way.
Right.
And that is so dangerous.
It is very
Exactly.
dangerous, and it's against the law.
Oh,
It's against
just
the law.
Just to start, it's against
Yes,
the law. But
yes.
there are so many repercussions that people do not think about when going to someone like that. But it's out of sheer need. I mean, I totally understand when there's no means and you feel like there is no other way, and especially if there's maybe pain involved.
Yes.
You're pushed to the limits. But wow, this is good to know for all of those people out there. You know, to take advantage of it.
Yes. I mean, we are here to serve, you know, and our board feels exactly the same way. We are here to serve those who need us. People always think, I don't need to go to the dentist. You know, I'll save it for later, you know, and in talking with my sons last night, because I said, okay, if I get asked this question, how do I answer? About what's the biggest misconceptions, because that was one of the questions on there. And they said about how oral hygiene is not that important. And it is, because, you know, you get an infection and it could lead to a staph infection, you know?
Yes.
And, you know, sometimes people will wait 10 years to go. They pay an obscene amount of money to get everything taken care of, and they feel amazing, and then they never come back. And my son says, yeah, they wait another 10 years till they're right back to square one, and then they come back.
Yep.
Instead of going like you're supposed to every 6 months to get your teeth cleaned and to get an assessment to make sure that nothing has developed.
Right.
Exactly.
So
Right.
that's what's so important, you know, maintaining our oral health and brushing properly as well.
Of course.
You know, I brushed in the morning. I don't have to brush when I go to sleep. No.
Yes,
I'm a
you do.
stickler
Yes,
for
you
that.
do.
I am a big stickler about that. Have you brushed your teeth? I'm going. And
No, but you're so right.
it
Yes.
is. And, you know, brushing is so important. And that's like I said, both my boys and even my daughter-in-law is in the dental field.
Wow.
Yes. So it's amazing how it all worked out. God always has huge plans, you know, and he
Yes.
puts us where he knows we need to be.
Yes.
It was only a matter of time until you came on board.
Yes.
Yes, and so around our dinner table, a lot of conversations
Is
about
around-
oral health is what we discussed for years, because my oldest son has been a hygienist for going on 11 years.
Right.
Wow.
There you
And
go.
my younger son, going on 7 years, and they both work together at the same practice.
Oh,
Yes.
Okay.
So,
nice.
yes. And so, you know, they were talking about the difference between an electric toothbrush and a regular toothbrush. You know, electric toothbrushes are supposed to be better, but
And are they?
Yes, I can't use a regular toothbrush anymore. It doesn't feel like my teeth are getting clean the way they're supposed to.
It's a more precise motion than just your manual, because you could miss.
Yes.
Okay.
Yeah, you're more prone to miss
Okay.
spots if you
Yes.
do it manually.
I had been considering, you know, but I just didn't look into the benefits or anything.
My
But
brother, ever since he switched to an electric toothbrush, he
he's
swears by
happiest
it,
man.
and he just
Wow.
Yeah.
But now hearing it from, of course.
Yes. No. And now the only thing is they said one of the misconceptions, you use an electric toothbrush and people, you know, kind
Yeah.
of
Still do the
They still do
motion.
the thing.
and they're
yeah.
like, no,
Not needed.
because it's not needed. You just hold it in place and let the bristles do their job because they're spinning.
Yeah, they're already spinning. I don't
There's
see why
that
you gotta do-
motion that
The
you
mo-
one
yes.
would do with your hand, right?
With a manual toothbrush, yes.
I guess it's so ingrained in us,
Yeah,
right?
we're
to
so
like
used to that.
do
We
the
have
motion.
to do.
Yes.
Because that was such a very, very early on concept with dental hygiene, is that you have to do the motions
Yes.
and get back there and all this stuff, and yeah.
And I tell you, I'm guilty of that. I'm so guilty of it because I'm a teeth person. I am
Well, for those of you, we'll put a picture, but she has the most perfect smile. You were made for the job.
No, thank you so much. I appreciate that. But yeah, I'm a teeth person. And you know, I'm a brusher in the mornings and at night, and you know, I just can't. I feel unsanitary if I haven't brushed my teeth.
It's already a habit
that
you carry, and you know.
And those are habits that honestly everybody should have.
Yes.
Because it does. I mean, decay is horrible. When you start getting tooth pain, you know, don't put it off. You know,
and I feel like people do.
They do.
It's until one feels pain that
until it's too serious.
You've
is when
taken
people
so many
get
Tylenols.
Yeah. Yes.
That's when you're like,
They go,
okay,
"Ya no
I guess I'll
aguanto."
go.
Well,
They're
I've
okay.
had employees that come in and they've got, you know, swelling,
Yeah,
and
'cause
I'm
they got
like,
infection.
well,
Oh my
yes.
gosh.
And nothing can be done until the infection has subsided and the swelling has gone down, that they can do something.
Right.
So if you're starting to feel discomfort, don't wait until you've got an all-out, blown-out infection, and they can't do anything until they control the infection first. And then it's just like if you're going to go have major surgery, you've got to get clearance from your dental doctor before you can go have surgery, because
Right.
they want to make sure that there's nothing
Exactly.
bad going
Of
on in your
course.
mouth.
Exactly.
So, but yeah.
I had a family member who they were about to get an extraction done, but they couldn't because they kept feeling pain, and no matter how many injections to numb the area or whatever that they're trying to do, still nothing. It was still, they could feel everything, and even when they were trying to do the extraction itself, because they were like, oh, well, we've already given you so much, you should be under already. Y nada. And then they said, well, it's inflamed. There's an infection. You need to get that taken care of first before.
Well, what happens a lot of times is, you know, when you go to your regular dentist for an extraction, they use lidocaine to numb the area. If your nervous system is very tolerant of stuff, it's not going to numb it.
Yeah.
So at that point, then they refer you to a maxillofacial surgeon, and then you get put under, and then they do, surgery where they cut your gum and stuff like that.
Right.
That happened to me because I have big teeth, obviously. My wisdom teeth were
they were coming out.
humongous.
Oh.
When they were impacted, they were like this. That's what impacted is. They were growing towards my other teeth. And so I went to my regular dentist to have them extracted. I didn't know, and they didn't tell me. And so this was very long time ago. I wanted to die. It hurt so bad.
So painful.
And he was like halfway, and you know, I could feel it.
Yeah.
They'd given me I don't know how many shots. And he's like, well, I'm just going to send you. And I'm like, you're already in there. Just get it out. And then I'll go do the other 3 with the maxillofacial surgeon. And sure enough, they were huge, huge. And so,
But then pain tolerance also has a play in it.
Yes.
That's why some
Yeah, it
people like
does.
lidocaine isn't enough.
right. Yes.
Wow.
Exactly.
Interesting.
Yes. So always listen to your dentist. But
Long story short.
yes, you know, and don't wait, because that caused so many consequences. Lockjaw. I don't know if you've ever heard of lockjaw.
No. Yeah.
Oh, that is so severe. I had major lockjaw. That's when your tendons in your jaws tighten and you can't open your mouth. I couldn't bite a sandwich. It took years and a lot of dental care. I had to wear a night guard.
Wow.
Oh, yeah. They even talked about surgery, and I'm like, nah. But it eventually went away, and you could hear it pop.
Yeah.
I have a friend who had to go to Dallas to get treatment, and she had to have surgery because it was so bad. So lockjaw is really, really...
I had an aunt who had it too. She
Yes.
had it for a few months.
Yes. No, mine was,
Yeah.
I want to say, almost a year. I would have to put food on the tip of my lips and then push it in
right.
because I
You
couldn't
couldn't
open.
open
I could not open. It hurt so bad.
And what about talking?
It's
different than
Than actual like
Yeah.
biting?
Yes.
Or like opening your mouth to take a bite?
You don't have to open your mouth too much to
No,
talk.
because you can move your lips a
You
little
can
more.
murmur and talk
Wow.
I don't even
voice.
remember that part. I just remember I couldn't eat very well.
That was the thing with my aunt who had it too. She was just complaining she couldn't eat, and it was just annoying to not be able to
course.
open your mouth.
Yes.
Wow.
She's a
Yes.
talker too, so
Yes. Yes.
she's like, I can't talk at full volume, and yeah, it's a thing.
Yeah. So, but no, there's so many facets of it, you know. just like with getting braces. Cosmetic, it's for your appearance, it's your self-esteem.
Right.
So, I mean, we don't help with braces because that's more of a cosmetic.
Okay.
Now, for older people, and maybe not even older people, but if people need dentures, we have a lab that has partnered with us that they will provide 20 dentures to us a year.
Okay.
And so one of our volunteer dentists will oversee the fittings of the dentures for the patient
So you
that
can
might
service
need
up to 20 people per year based on the
with
dentures.
dentures, yes.
Wow.
Because think about it. And that was something else we discussed last night. When people don't have, any teeth at all, that's why in older people you see their lips start sinking in.
Right.
And
Because there's nothing to hold them out.
Exactly.
In a sense.
Right.
And then they start losing a lot of the bone mass because they don't have anything supporting,
because they have
jaws.
no bones there.
Yeah.
Oh, essentially,
their jaws,
right?
yeah.
Wow.
So and also for their self-esteem,
Of course.
and then they start having digestive issues because they can't chew the food.
Right.
So it's just
It's one thing, yes.
a domino effect.
Yes.
Dominoes, yeah.
Yeah.
So in the list of services that you can provide, what's the range?
I mean, anything that's not considered cosmetic.
Okay.
So, like braces, we won't do.
Okay.
I mean, and I know that dentures are cosmetic, but they're also a necessity.
Right.
So, in this case, we will cover it.
Okay.
And so, extractions, root canals, bridges, crowns.
Okay.
Gotcha.
So,
Okay.
most anything. I mean, again, it's for quality of life.
Of course.
It's for quality of life.
And so I have a follow-up question to sort of like the application process. Let's say someone hears this podcast, they are interested and they find you on socials and somewhere or the other they land on your website. Right. How would the application process look like? Do they call? Is there a form that they fill online, or walk us through it?
So the forms, the applications are on our website.
Okay.
And they're PDF fillables. Or there's a QR code that they can pull up and it's got the application.
Okay.
Or if they don't have a computer or what have you, they can call our office and they can talk to Mary, and Mary will help them fill out the application, and then we'll handle the process from there. So she'll handle the application. She'll find out where they live and then what dentist is closest to them. Call and see what the earliest appointment is. It's not months. It's maybe a week's time before they can
that's
get
good
in.
to know,
Yes.
right? Because some people might assume like, oh, maybe your caseload is,
Yes.
so large that why even call? Why bother?
No, never hesitate to call, because if it's not one dentist that can see you, we'll find another one.
Nice.
Yes. So, I mean, and we're building that the base of volunteer dentists too. We have Rodeo Dental that works with us. We have a lot of our local dentists that work with us. So, and we have specialists. I need a pediatric dentist. If anybody out there hears this and they want to help us, by all means. And I mean, we're never going to turn any doctor away from volunteering with us, just like we're never going to turn any patient away that needs any help.
Wow. So you want that network to build
continue to
and
grow.
that patient load to also
Oh,
grow.
absolutely. I mean, coming in January, taking a look at what we had to work with financially, because we are 100% grant-based and donations.
Okay.
We don't get any funding from anybody other than grants. Right. And then people have made donations to us. I started applying for more grants. I've applied for 9 different grants since January.
Oh, well, good luck.
Yes, but I'm hoping so.
Right.
Just because the more money we can get, the more patients we can serve.
Of course.
And, more outreach can be done as well. Because I had to order step-in repeats, I had to order banners, because that way our presence will be seen wherever we go.
So I want to know that you guys are active and out there.
Exactly. Well,
And marketing takes a huge chunk.
yes, it does. A lot.
It does, but it's needed because there's no other way.
There isn't, and yes, we can do probably commercials and stuff, but we don't have the money for that.
No,
So we have to do the print.
To result.
Because, people want to see something. They want to be able to read. And then I was talking to the Wellesley nurses because they're part of our network. And they're like, do you have them in Spanish? And I'm like, hello. I didn't think of that. Yes. He's like, for every one English we give out 4 Spanish.
Yeah. But let me tell you something, and Javi is here as a witness. You are so focused on getting the brilliant idea that you had for the flyer or brochure or poster, right? And it's in English, of course, because that's how the idea originated. You get it approved, it's everywhere, and then it's like, yeah, and now you need it in Spanish. You were just so focused on getting the one item out that it's not that you forgot. It was not factored in.
It wasn't. But immediately I said, okay. So I translated it, and then I had my husband's very proficient in Spanish and written also. I'm like, okay, you got work, you got homework. You need to proof this for me.
Oh, you thought you were done?
I was thinking.
I have a job for you.
To this day, he still shudders. When he hears that. I was thinking, oh no, what's going to hit me now? Oh. So we got the Spanish brochures.
That's good.
So I brought some today because when I was here, that I spoke with Esmer and the team, I had the English ones, but I didn't have the Spanish ones. So, and as a matter of fact, here you go. I just had to order another 5,000. I had to order 2,500 English and 2,500 Spanish. Fast. Yes.
Especially the Spanish ones.
Yes. Especially because, that's reading material that, we've been giving them out like.
And aside from, and I don't know if people think about it like this, but when you have something tangible or you have the website up and everything matches, and what you're saying also matches, you're building that trust.
Yes.
Oh, yes.
You are making yourself a safe space for people to be able to make the decision of being like, you know what? It might be worth calling. It might be worth applying. It might be worth.
A commercial is nice, but if you're out there actually handing these out in person, that tells a lot.
Exactly.
Yes. Well, and we're there to answer any questions.
That's the other thing. You're there to answer questions that they have. Because you can only say so much on a commercial that's like 15, 30 seconds.
Exactly. You're not going to get the message across.
No.
You're not.
You're putting also a face to the name. And that just built, because it boils down to trust, really, on whether, they say that, they do all this, but do they really? Right. And then they hear you, and that assertiveness and the energy is, you can't beat that. So they hired the right person. You're doing a great job, Norma. You're taking on something big, something that has existed for a while. Sometimes whether people hear of it or not, it's a double-edged sword sometimes. Maybe they had heard. But I'm not saying that it might have been negative or it might have been positive. It might have been a neutral. Yeah. But if you turn that into a positive and you brought someone on board, hey.
Yeah, I'm super excited.
Well, is there anything else that you would like to add that we haven't gone over?
Well, like I said, we're in McAllen. We're at 1418 Beach Avenue, Suite 124. If anybody can go to our office if they need help, if they want information, they can call us at 956-318-3383. We're on all social media platforms. We have our website, which is dentistwhocare.org. And so, if somebody wants to reach us, they're going to find us because we're out there. We've been trying to post more on our social media platforms so that we can come up more of the algorithms. Of course. And just put our name out there.
Now, just to clarify, if they were to call, it would be during office hours, correct?
Yes, Monday through Friday from 9 to 4. Or they can email us. Our emails are on the website. Perfect. They're on the brochures. Somebody can find us if they really wanted to. We're out there.
And of course, if people need assistance with filling out their applications, you guys are more than happy to do
absolutely. So as well. We will help them fill out the application. We will send it into the doctor's office. We will make the appointment. We'll set everything up for them. And even when I'm trying to take it even a step further, because I don't want there to be any issue of why they can't make their appointment. If they have transportation issues, we will help them with the transportation as well.
Very nice.
Nice.
We want them to get their dental care.
Like 100%, all the way through the process.
Yes.
That is amazing to hear. Ms. Norma, you have been a pleasure to have as a guest.
Thank you for inviting me. This has been an amazing experience for me as well. Thank you.
I'm
Thank you
so
much for
glad
being here.
she said yes. So nice meeting you, and thank you for the amazing work that you're not just doing now, but that I'm sure you have prepared for us in the future.
Yes.
So excited to witness that.
Thank you.
Thank you very much. And thank you so much to our guest, Miss Norma Guevara, Executive Director from Dentists Who Care. Thank you so much for joining us on another episode of Health Yes. And remember to follow us on all of our social medias, click those notification bells, buttons, what have you, so you don't miss out on another episode of Health Yes. Thank you so much for joining us. And remember, stay safe, stay healthy, and stay educated. We'll see you on the next one.
Bye.
Bye-bye.